Welcome to another educating series on eye care beyond the eye clinic. This is a journey to a healthy eye practice. So last week we had two questions that were asked from the video that was released. The question one says, what happens when the eye pressure is less than 10 millimeter mercury? So basically we talked about the fact that the normal pressure is 10 to 21, right? So let's talk about ocular hypotony. See, note that it's not all pressure that is below 10 that can actually cause a problem. But for ocular hypotony, we're talking about cases where a patient is now becoming symptomatic, and usually some people say that it is when it is less than 6, some say when it is less than 5, but the idea is that for different persons it may vary. So most of the things that a person with low eye pressure can experience, especially when it comes to ocular hypotony, is that there may be a distortion in image. The image may not be normal, like they see images differently from what they should see it as. Another obvious thing you may want to find where there is ocular hypotony or low blood pressure that is symptomatic is the case where cataract formation is faster. Cataract, I'm not sure I'll be able to explain the mechanism of that here so that it doesn't become too complex, but just know this, that cataract formation is faster where the pressure is low. Right? Then also there's going to be some visual disturbances like blurry vision. Just think of it as when someone has very low blood pressure. The person may tend to be weak, feel dizzy like that. So that kind of bodily discomfort is also experienced where there is low eye pressure, right? So, but note that it is not all low pressure in the eye that is symptomatic. That means it's not all low pressure that will cause a patient to have complaints. I've seen patients with 8, with 9, and they don't have complaints at all. So some of the things that can actually cause this kind of low pressure, maybe a person did an operation and for some reason or the other there is a leakage. So that can also cause it. Trauma, accidents can also cause it, right? So there are lots of factors that can cause that, but those are the two major ones I'll just mention. Question 2 says, please explain what eye pressure greater than 21 actually means. So like there is a normal range for everything in the body, even BP, sugar, there's a normal range. But in a case where the pressure is now more than 21, you may want to find out what is causing it. So what it actually means is that it could be, number one, ocular hypertension. Ocular hypertension simply means that the eye pressure is elevated, but there are no signs of damage at the back of the eye. There is no loss of vision. That's what we call ocular hypertension. In this case, so many things can cause it, even down to stress. Somebody said one of the most difficult things for humans to do is to rest. If you tell them rest is like one big impossible thing. But I've seen cases of stress causing someone's pressure to get to 38. Yes, I've seen it, and I knew it was stress. So what I did was to recommend bed rest for that patient. And though it took a span of time, the pressure gradually dropped and then has remained normal, and it's been more than 2 years with no defect at the back of the eye that will now cause vision loss or anything, no defect. So constantly checking the pressure of the patient to ensure that everything, and it has been within normal, and we have learned better how to manage stress levels. So it's very, very important. So ocular hypertension, yes, a lot of things can cause it, but note that ocular hypertension can also result in glaucoma. So now 10 to 21 is normal. If it's greater than 21, it's disturbing. Some people can have up to 50, some can even have up to 75. Yes, very alarming. Yes, I remember the first time I saw a 75 for eye pressure, I was like, wow. Another thing that can happen when the pressure is more than 21 is that it can result in glaucoma. But there are so many factors we look out for. It's not just pressure. When it comes to diagnosing for glaucoma, it is not just pressure. But I must not also forget to mention to you that even when a person's pressure is within normal, it doesn't mean that the person may not have damages at the back of the eye or loss of vision. Do you understand? So there's what we call normal tension glaucoma. In this case, the pressure is normal or is within normal, but there is a damage going on at the back of the eye, and then there is vision loss going on as well. So that can happen. So there are a lot of factors to consider. So in a simple term, even within the normal range, everybody has their own normal. So it all depends on a lot of factors. I hope I've been able to answer your question. Please feel free to ask if you are not satisfied. By next week, we're going to be talking about those avoidable causes of increased intraocular pressure. I'm going to focus on things that can make your eye pressure to go elevated more than normal. The avoidable, the ones that we cause ourselves. That's what I'm going to focus on. And then we're going to go into food on our eyes. I have some amazing topic. I don't know how I'm going to blend it, but the package coming your way is pretty amazing. Right, so I have a question for you. If you have listened to the end here, please do well to answer the question. And the question is very simple. I mentioned 3 different conditions: 1 related to low eye pressure, and 2 related to increased intraocular pressure. And I also mentioned 1 that can be as a result of normal pressure, but there is still damage at the back of the eye. Can you tell me the 3 names? I hope to see your responses. Thank you very much for participating today. God bless you.